Hello everyone, and welcome back to my channel. Today, we'll be talking about a very important topic that often doesn't get enough attention: postnatal counseling and psychological support. After childbirth, the journey of motherhood truly begins. The postnatal period, which covers the first 6 to 8 weeks after delivery, is a crucial time, not just for the baby, but also for the mother and her family. During this stage, the mother goes through a lot of physical changes as her body recovers from pregnancy and childbirth. But it's not only the body that needs care. The emotional and social adjustments are just as important. Postnatal counseling is the supportive and educational process provided to mothers, newborns, and families after childbirth to promote physical recovery, emotional well-being, successful infant care, and healthy family adjustment. It involves guidance, reassurance, and health education on topics such as maternal self-care, breastfeeding, newborn care, family planning, danger signs, nutrition, and emotional support. When we talk about postnatal counseling, the main goal is to guide and support mothers as they adjust to life after childbirth. Let's break down the key objectives. The first objective is promote maternal physical and emotional health. After delivery, mothers need time and care to heal. Counseling helps them understand self-care, rest, nutrition, and also cope with the emotional ups and downs that are common during this period. The second objective is support breastfeeding and newborn care. Many new mothers have questions about feeding, sleeping patterns, or baby hygiene. Counseling provides guidance and confidence so that mothers feel well prepared to care for their newborn. The third objective is strengthen parent-infant bonding. The early weeks are crucial for building attachment. Counselors encourage skin-to-skin contact, responsive feeding, and involvement of both parents to create a loving environment. The fourth objective is identify and address psychological concerns early. Sometimes mothers experience postpartum depression, anxiety, or overwhelming stress. With timely counseling, these issues can be recognized and managed before they become serious. The last objective is educate about family planning and maternal role transition. Postnatal counseling also covers spacing of pregnancies, contraceptive options, and helping the mother adjust to her new role with confidence. In short, postnatal counseling is not just about medical advice. It's about empowering mothers, supporting families, and ensuring a healthy start for both mother and baby. Let's begin with the first component of postnatal counseling: physical care and education. After delivery, the mother's body needs time to heal. So rest is extremely important, along with a balanced diet, plenty of fluids, and good personal hygiene. If the mother has had a cesarean section or an episiotomy, she should be taught how to keep the wound clean and watch for signs of infection. Breast care and lactation support are also key parts of recovery, making sure the baby is feeding well and the mother is comfortable. Another important part of counseling is contraceptive advice and reproductive health education, so that mothers can plan their next pregnancy safely and confidently. Physical care combined with the right education helps the mother recover smoothly and stay healthy after childbirth. Now let's talk about newborn care guidance. One of the most important things is feeding. Babies should be given exclusive breastfeeding for the first 6 months, meaning no water, honey, or any other food, just breast milk. Proper hygiene is also essential, including cord care to prevent infection and following the immunization schedule to protect the baby from diseases. Parents should also be aware of safe sleep practices, like always placing the baby on their back to sleep and keeping the sleep area free from pillows or soft toys. Finally, recognizing early danger signs such as difficulty breathing, fever, poor feeding, or unusual drowsiness is crucial, because getting help quickly can save the baby's life. Good newborn care sets the foundation for a healthy future. Another very important part of postnatal counseling is emotional and psychological support. After childbirth, many mothers experience mixed emotions, and it's important that they feel heard. Simple acts like listening with empathy and encouraging mothers to express their feelings can make a huge difference. Some may face anxiety, guilt, or stress as they adjust to their new role, and proper guidance can help them cope with these changes. Involving the partner and family members is also very helpful, because when a mother feels supported at home, her confidence and mental well-being improve. Emotional care is just as important as physical care, because a happy and supported mother is better able to care for her baby. Let's now look at some psychological challenges in the postnatal period. The most common one is the postnatal blues, also called the baby blues. This usually appears a few days after delivery and is marked by mild mood swings, frequent crying, irritability, or feeling low. It's very common and usually resolves on its own within about 2 weeks. What mothers need most during this time is understanding, reassurance, and emotional support from their family and caregivers. It's important to remember that baby blues are temporary and do not mean the mother is weak or failing, just that her body and mind are adjusting after childbirth. Another important psychological challenge after childbirth is postpartum depression, or PPD. Unlike the mild baby blues, PPD involves persistent sadness, extreme fatigue, loss of interest in usual activities, and difficulty bonding with the baby. These symptoms last longer than 2 weeks and can affect a mother's ability to care for herself and her newborn. It's very important to know that PPD is a medical condition and requires professional help. Early recognition and support from healthcare providers, family, and counseling can make a big difference in recovery. Mothers experiencing these symptoms should never feel ashamed. They deserve care and support. A rare but very serious psychological condition after childbirth is postpartum psychosis. This is a severe mental health disorder where a mother may experience delusions, hallucinations, confusion, or extreme agitation. Unlike baby blues or postpartum depression, postpartum psychosis is a medical emergency and requires immediate psychiatric care. Early recognition, urgent medical attention, and support from family and healthcare professionals are crucial to protect both the mother and the baby. Awareness of this condition helps ensure timely intervention and safety. Now we will discuss about the important strategies in postnatal counseling. One of the most important strategies in postnatal counseling is active listening and empathy. This means giving mothers the space to express their feelings openly, without judgment. Simply listening carefully, showing understanding, and validating their emotions can make a huge difference in their confidence and mental well-being. When a mother feels heard and supported, she's more likely to cope effectively with the physical and emotional challenges of the postnatal period. Another key strategy in postnatal counseling is reassurance. Many new mothers experience mild emotional changes after childbirth, such as mood swings or tearfulness. And it's important to let them know that these feelings are normal and temporary. Reassurance helps reduce anxiety, builds confidence, and encourages mothers to trust their ability to care for themselves and their baby. Another important strategy in postnatal counseling is education. Mothers benefit greatly when they receive clear and practical information about caring for their newborn. Breastfeeding techniques, getting enough rest, and maintaining good nutrition. Providing this guidance helps mothers feel more confident, reduces stress, and ensures both their own health and the baby's well-being. Another key strategy in postnatal counseling is problem solving. This involves helping mothers identify the stressors or challenges they are facing and suggesting practical coping strategies. Whether it's managing a fussy baby, dealing with fatigue, or balancing household responsibilities, guiding mothers to find solutions empowers them, reduces stress, and improves both their emotional well-being and their ability to care for their newborn. An important part of postnatal counseling is partner and family involvement. Encouraging the partner and family members to share responsibility in newborn care not only eases the mother's workload, but also strengthens the family bond. When mothers feel supported at home, they are less stressed, more confident, and better able to care for their baby. Family support plays a big role in both the mother's emotional well-being and the baby's healthy development. Finally, an essential strategy in postnatal counseling is referral. If a mother shows signs of postpartum depression, postpartum psychosis, or thoughts of self-harm, it's crucial to refer her promptly to a healthcare professional or mental health specialist. Early intervention can prevent complications, ensure the safety of both mother and baby, and provide the support she needs to recover fully. Recognizing when professional help is needed is a key part of effective postnatal care. Next, we will see about strong nursing role in postnatal psychological support. One important role of nurses in postnatal care is to provide reassurance and encouragement to new mothers. By listening empathetically, validating their feelings, and offering emotional support, nurses help mothers cope with mood changes, stress, and anxiety after childbirth. This guidance not only boosts the mother's confidence, but also promotes a healthy mother-baby bond and overall well-being. Another key role of nurses in postnatal psychological support is to screen mothers for postpartum depression. This involves observing for signs like persistent sadness, loss of interest, fatigue, or difficulty bonding with the baby. Early identification allows nurses to provide timely support, refer the mother to a mental health professional if needed, and ensure both the mother's and baby's well-being. Screening is an essential step in preventing complications and promoting a healthy postnatal period. The next role of nurses in postnatal psychological support is to facilitate support groups and peer counseling. Bringing mothers together allows them to share experiences, discuss challenges, and learn from each other, which can reduce feelings of isolation and stress. Peer support provides encouragement, practical tips, and emotional reassurance, helping mothers feel more confident and supported during the postnatal period. An essential part of nursing support after childbirth is to educate families about warning signs in new mothers and when to seek professional help. Families should be aware of symptoms like persistent sadness, extreme fatigue, inability to bond with the baby, or any thoughts of self-harm. By recognizing these signs early and seeking timely medical or mental health support, families can help ensure the mother's safety and well-being, as well as the healthy development of the baby. Finally, an important role of nurses in postnatal psychological support is to refer mothers to mental health professionals when needed. If a mother shows signs of postpartum depression, postpartum psychosis, or any thoughts of self-harm, timely referral ensures she receives specialized care and treatment. Early intervention not only protects the mother's health, but also supports the baby's well-being and strengthens the mother-baby bond. To summarize, postnatal counseling provides holistic care that addresses the physical, emotional, and social needs of new mothers. Offering early psychological support helps prevent complications, boosts maternal confidence, and promotes a healthy bond between mother and baby. By combining education, emotional support, practical guidance, and timely referrals, postnatal counseling ensures both the mother and newborn thrive during this crucial period. That brings us to the end of today's session on postnatal counseling and psychological support. I hope you found this video informative and helpful. Thank you so much for watching, and don't forget to like, share, and subscribe for more nursing and health-related content. See you in the next video. That brings us to the end of today's session on postnatal counseling and psychological support. I hope you found this video informative and helpful. Thank you so much for watching. And don't forget to like, share, and subscribe for more nursing and health-related content. See you in the next video.